Now, what has amazed me in all this from the start is that almost no one is paying attention to the country which is, without question, the most successful in fighting this coronavirus, Taiwan. It has about our population, but just 7 deaths. In Australia, 128. And we think we're doing well. Taiwan, 7. So why is this amazing success being almost ignored? Well, one reason is that Taiwan is banned from the World Health Organization. Officially, at the WHO, it does not exist. And it does not exist because China says it does not. China says Taiwan, an independent democracy, is really just the renegade province of China. And China will take it back, and until then, no country may recognize it. Well, damn that. To explain the miracle in Taiwan, I have invited Dr. Tony Chen. He's the Vice Dean of the National Taiwan University's College of Public Health. Dr. Chen, thank you so much indeed for your time. Just 7 deaths from the virus in your whole country. How did you do it?
Thank you so much for your invitation to get on the show to explain. I think because after 2003, Taiwan had a SARS experience. So we have a well preparation for number of bed in ICU. So, and also because we have very good border control, so we have few cases. So our clinical capacity can accommodate, even they have a case, they can take care very well. So that's why we have low case fatality as well.
You learned from SARS like we didn't. And I've talked to tourists there who said they got tested so many times. They got tested like 4 times at the airport leaving Taiwan, not once when they arrived in Australia. Can you believe that?
Yeah.
But can I go through some of the things that you do or don't do?
Right.
People in quarantine. What does Taiwan do to make sure they are there in quarantine and not walking down the street?
Right. I think as I have seen on your show, Taiwan and in addition to border control, we have very, very good, the digital contact tracing by combine the police system with the national health insurance record with the migration office data. So once you have been quarantined, even from abroad, you have to quarantine for 14 days, and police with the APP system can trace you, whether you stay at home, and they also send, basic needs and food to you with health official people. So we all control very well about the quarantine system to isolate the people who are suspected for COVID-19 at home.
Dr. Chen, so I've heard, tell me if this is true, that, for instance, you've got to, the police monitor the location of your phone. If you leave your house, a notice will go up and you'll get a call within seconds.
That's right. That's right. Even you go to the convenience store about the 7-Eleven, maybe only in 2 minutes, they can always, trace your footstep. So they can immediately, ask you to go back home, to isolate, to self-isolate.
Well, that's something we should have learned. Professor Chen, Dr. Chen, there's another thing. In Australia, 1 in 3 of the people who have died in aged care homes. That somehow, I don't know how we did it, we let the virus in and they died there. What do you do to protect them or any people, old people who are still at their own home?
Yeah, I think this is also we learned from the China in the very beginning of the January. We know this virus has been characterized by infecting the young people first, then infected to the elderly peoples. And the elderly peoples is vulnerable to die from this disease. So in the nursing home or in the home, we always advise the young people when you contact with the old people, you have to wear the facial mask, and you have to washing your hands frequently if you have already touched the service the elder people already touched.
In Australia, in Victoria, the state that I'm broadcasting from, you must, as of tonight, by law, wear a face mask, not just inside, which is the place this virus mainly transmits, not outside. You must, by law, wear the mask outside as well, even if you're on your own. Is there such a law in Taiwan? Is there also another law like we have in Victoria, closing restaurants or closing markets?
Right. Actually, as a matter of fact, we don't have a law to ask people to wear the facial mask. But you know, again, after the SARS experience, people are very high alert about this pandemic. So they will wear a facial mask, you know, voluntarily with very, very high compliance. I can give you one example. In 2003, if I took the taxi drivers, you know, if you the taxi driver have already seen you you wear the facial mask, they were very scared and they don't want to pick you up. But you know, 2020 right now, every taxi drivers, they are welcome to drive, you know, the passenger wearing the facial mask. So that's quite different. So in Taiwan, people are very, very with the very high compliance with these habits. I think this is one of the change of culture in Taiwan. So that's why we have very, very low transmission probability of infection from even people from abroad.
Tony Chen, it's a remarkable what Taiwan has done, and I think one of the things you alluded to just then, the high level of social cohesion, is something I'm afraid you don't quite see in Australia, and I think that obviously helps a lot. Dr. Tony Chen, thank you so much indeed for your time, and congratulations.
Yeah, thank you so much, and my pleasure. Yeah.